Welcome to our webinar. We appreciate your time and your coming to join us, and we think you'll find a lot of good things today. We're going to go ahead and get started. We may have more people joining as we go on. But you are at Mission, West Virginia, and our webinar today is on puberty and mental health, so it ought to be very interesting today. But first of all, let's talk about who is Mission, West Virginia. We are leading a statewide effort to promote positive futures for all kids in West Virginia. We will work alongside families as they navigate West Virginia's foster care system and provide evidence-based life skills education to help teens envision, and not only that, but create positive futures. As a result of our work, putting kids first in collaboration with social services, school districts, private foster care agencies, and other nonprofits, the future is looking much brighter for West Virginia children. We have two very distinct programs within our company. Frameworks provide support for those interested in foster care or kinship care. We help them understand the system. We help them find a placement agency. And we are a support both before, during, and after to make a meaningful difference in the life of a child. And if you're interested in learning more about how to become a foster or an adoptive parent, you are in the right place. If you want to speak with someone, you can call 866-CALL-WVA, call Mission West Virginia, or 304-512-0555, or you can also go to our Facebook page. And then on our website, there is an information package that could answer your questions. And if you still have more, call us and just call and ask. We have great resources. We have people who know the system inside and out, and they can really educate you about the process and help you walk through it if you're interested. The other program we have is the THINK program, which stands for Teaching Health Instead of Nagging Kids. And that empowers teens, educates them to make positive life choices. We teach life skills and coaching. Our programs are all evidence-based, the curriculum that we use. And we help the students we work with navigate the social, emotional pressures all teens face as they developed. I know I wish I would have had that teaching when I was a teenager. This includes building healthy relationships and healthy choices around drugs and alcohol and teen pregnancy prevention. We deliver our program in partnership with schools in over 20 counties. And we work with school leaders, teachers, anyone that we can, anyone who works with kids, we will come out and help train you. The curriculum has shown to have a positive effect on preventing and reducing teen pregnancies, sexually transmitted infections, or sexual risk behaviors. And our educators are all the time being trained on the most up-to-date information on trauma, sexual health, and high-risk behaviors. And our management team is wonderful in that they do a lot of on-site observations of our educators to regularly ensure that fidelity is being followed and that every child is getting similar education. And we also administer pre and post surveys. We receive teacher feedback, we hold teen focus groups, and we have site satisfaction surveys to help ensure that everything is going out is the same messaging across the board. We also hold workshops and trainings. We know that it takes a whole village to help teens envision and create positive futures. So we provide resources and training to help with parents, families, and individuals who support kids as they navigate their teen years. And they include talking to youth about sensitive or hard topics. We help with Hidden in Plain Sight. If you have not seen that program, reach out to us. It's very positive and informative. We do trainings including trauma, sexual assault prevention and consent, teen dating violence, and much, much more. We are happy to say that CEUs will be offered for social work and nursing by First Choice Services for this webinar. You must complete the evaluation link by April 28th in order to be considered for CEUs. And as always, the attendance will be cross-referenced with the Zoom attendance log. There's a QR code that you can take a snapshot of now, or we'll drop a link in the survey in the chat, and then a link will also go out via email to all participants probably tomorrow. So if you don't get one of those and you still need CEUs, reach out to us and we will take care of that. Today, you're in for a treat. Those who have not heard Mrs. Autumn Wagner speak, she is our Youth Resource Coordinator here at Mission, West Virginia. She holds her bachelor's in social work from Akron and is a licensed social worker in West Virginia. You can see her information there. In her position here with Mission, she works closely with students who identify a need for resources or community referrals. She also provides education on numerous topics. She's a great guest speaker to a lot of different agencies. She acts as a bridge of support for students who need a trusted adult to speak with to help them work through any difficult situations they may be experiencing. She loves her work with her students. Sometimes people just need one trusted adult that they can talk to. We know that that is a resiliency factor, and Mrs. Autumn helps provide that for the students in the counties where we teach. So I'm going to let Miss Autumn take over and sit back, and I hope you enjoy the presentation, but mostly I hope you learn something that maybe you didn't know before. Take it away, Miss Autumn.
All right, thank you, Miss Rita. All right, let me go ahead and share my screen.
I don't.
Oh, Rita, if you can just stop sharing your screen so then I can open up mine. There we go. Thank you. Okay, perfect. Oh, hold on. Okay, there we go. I forgot to add my sound. All right, so welcome everybody to this webinar. This is puberty and mental health. So we are going to be talking about a lot of great things today. We'll go over about, is the youth, what they're displaying as far as their behaviors? Is it something that is normal with puberty, or could it be something more and more of a mental health issue? So I will be going over all of that. And I also will be going over some mental health disorders and what some of their symptoms are. And if you have been to any of my presentations where I talk about mental health, I always ask to please not use this as a way to diagnose any youth or yourself or any family members. This is just for educational purposes. And if you are concerned for yourself or youth, please reach out to somebody that is licensed, whether it's a social worker, counselor, psychologist, a doctor, psychiatrist, anybody like that. And if there are concerns and you are wanting to get some referrals for yourself or some youth, at the end I will have my email address. You will always be more than welcome to reach out to me, and I'll be more than happy to give you some of those referrals if you need it. All right, so when we look at mental health, this is the definition from the CDC. So according to the CDC, mental health includes our emotional, psychological, and social well-being. It also affects many aspects of our life, such as how we think, feel, and behave. And it also helps determine how we handle stress, relate to others, and make healthy choices. So that's why our mental health is so important, because not only does it impact us individually, but it also impacts the people around us, the people we interact with on a day-to-day basis. So what is puberty? Again, this is the definition from the CDC. This is a time of many physical, mental, emotional, and social changes. Hormones change as the puberty begins. This is when boys will start to grow facial hair, pubic hair. That's when their voices will start to deepen. And then for girls, they will begin to grow pubic hair and breast, and when they start their period. So when we look at mental health and puberty, we can see that there is a lot of correlation between the two of those. And that's why sometimes it can be hard to determine if what our youth is going through, is it just a puberty thing or is there something more to it? So this is emotional and social changes that happen during puberty. So they may show more concern about their body image and how they look and the type of clothes they wear. That's really big during this stage. They may focus on themselves more, going back and forth between high expectations, putting a lot of pressure on themselves, maybe lacking in confidence, especially if they're engaging in new things, new activities, new friends, different things like that. They may experience more moodiness. They can show more interest in and influenced by their peer group. So they're going to want to hang out with their friends more, and they're going to be more influenced by whatever their group of friends are doing. And so it may be something they've never done before, but if all of their friends are doing it, then they may be feeling like they should be engaging in that as well. They may express less affection towards parents or caregivers. We have all seen that before, where it's like, you need to get out of your room more, come spend time with us. You're in your room way too much. But that can happen as they start going through this phase. And sometimes they can even come off as being rude or short-tempered. They are going to start to feel lots of stress from more challenging schoolwork. I can remember going through this stage, and I, struggled in school in certain subjects. And sometimes I was like, man, I just miss the days where my schoolwork was cutting out shapes and, using glue and, and, paper and making like cute little pictures and stuff like that. But it's definitely a lot more challenging as you get older and you start to get into more difficult things in school. They can start to develop some eating problems, whether it's eating more than they should or not eating enough. They can also feel a lot of sadness and depression, which can lead to poor grades at school, alcohol and drug use, practicing unsafe sex, as well as other problems. So as you can see, again, these emotional and social changes during puberty, a lot of the things that they go through can definitely mimic a mental health issue. So why do we go through these emotional changes during puberty? There's lots of reasons. Sometimes we think that teens are just being buttheads, but there's actually reasons that they go through these emotional changes. The physical changes that are associated with puberty become the basis for the new emotional experience. Sometimes going through puberty can be really awkward and uncomfortable, especially with girls, when they first have to start wearing a bra and when they first start their periods. And for guys, it's their voice will crack and change, and it'll be high pitched and low pitched. People can make fun of them. So they're just going through those physical changes is going to bring on these emotional changes as well. So it's very common for parents to notice that their children are being more moody and irritable during this time of their life. And these moodiness can be attributed to these fluctuating hormone levels. And so when puberty starts kicking in, these hormones are going all over the place. And sometimes they're not very well controlled because, they're going through all these changes. So they have like these raging hormones that can impact their mood. Also during puberty, the body is adjusting to those hormone levels. And so that can also create those mood swings as they're going through that as well. There's also several other physical causes accounted for the mood swings, just apart from those fluctuating hormones. So the first one, lack of sleep. Children's moodiness could definitely be affected by their lack of sleep. Even adults, I know if I don't get a good night's sleep, I'm a little cranky in the morning. So lack of sleep can definitely contribute to that that moodiness. There are both physical and social reasons why sleep deficits can occur during puberty. So the body's sleep-wake cycle is dependent upon the circadian rhythm, and that is influenced by the hormones. So during puberty, that natural shift will take place, and during the teen or in the teen's circadian rhythm, and it causes them to feel more awake later at nighttime. So they're going to stay up later at night. It's going to be more difficult for them to fall asleep, but unfortunately they still have to get up early for school and do other activities, not only during school, but if they're involved in extracurricular activities afterwards. So as a result, they tend to get less sleep than they require. And this is really happening right when their educational, extracurricular, and their social schedules are becoming more demanding. So even though they're tired, they have a lot of demands. And so that can account for some of that moodiness that they're showing. So that lack of sleep, it's going to increase their irritability. It's going to decrease their ability to concentrate and focus. And then sometimes teens can find it difficult just to complete tasks that were once simple. And so this new struggle of this lack of sleep and, not having enough time in the day to do all the things they want to do is definitely going to add to those mood swings. The next is teen brain. So teen brain plays a huge role as far as the mood swings that they experience. And that's because their brains are actually still maturing. Some people think that when a teen goes through puberty, right after puberty, then, everything is fully matured. But teen brains are not fully developed until they're in their early 20s. And so that incomplete brain development is going to definitely be responsible for some of that emotional immaturity that they have that can definitely get on parents and caregivers' nerves. So cognitively immature people lack good judgment. So that frontal lobe of their brain is not fully developed. So that part of our brain is what allows us to have good judgment and make good decisions. So if that's not fully developed, plus we have all the pressures that they're going through of, trying to fit in and identify who they are and make friends, that is definitely going to play into that moodiness. So that's why youth definitely can come off as being very impulsive and hasty and sometimes even selfish. And we think, they don't even think about anybody else but themselves. But there's a lot more to it than really them just being selfish. The next is identity. So a teen's journey to establish their own identity can take a toll on their moods. It's definitely healthy for teens to seek that independence as they get older and establish their own beliefs, their values, their morals, their goals that may differ from whoever is raising them. But as they establish that independence, they're likely to experience some inner turmoil because maybe they're frustrated because they don't really know who they are, who they want to be, or they're still questioning some values and beliefs, and that can also come off as them being moody. The next is self-expression. So healthy teen development leads teens to ask themselves, who am I? Who am I as a person? What are my interests? What are my hobbies? What kind of style do I have? Also, they may be trying to figure out their sexual orientation at this time. But this evolving question can definitely play a part in their changing moods. So for example, a teen may dress in black clothing and appear as if they're emo or goth for 6 months, only to turn around and they're dressing, in bright colors, flower patterns, different things like that. So it's very common for youth that are going through this stage to kind of switch up their identity just to figure out if this is who they are or maybe if it's something different. Next is independence. So establishing independence can definitely cause teens to have a variety of different emotions. They can feel sad, lonely, scared, and also exciting about this new freedom that they're starting to reach as they are getting older, and soon they're going to become an adult, but it can definitely be scary. Adulting, as all of us know, because we are adults, is definitely not what it's cracked up to be. I definitely had different ideas and thoughts and expectations of what it was going to be like when I was an adult. I should have listened to my mom and dad more often, but I know they're not listening, but I do sincerely apologize for being a butthead to my parents during this time. But, just trying to figure out what they want to do with their lives and, just maturing and becoming that adult can play a role in mood swings. Next is stress. So I don't know about everybody that's on this webinar, but for myself, when I'm stressed out, I'm not always in the greatest of moods. And, that's why I try to tell my students that I work with, if you think of a time when you were physically sick, when you were up all night, you were vomiting, you had a fever, you had body aches, you're probably cranky. I know I'm cranky when I'm sick. So when mentally and emotionally we're not feeling good, we're going to have those similar mood swings where we're going to be stressed out, frustrated, irritated, different things like that. School stressors is a huge part of stress in a teen's life, trying to keep their grades up, anxiety about college preparation or graduation, and just trying to figure out what they want to do with their life after school. And sometimes maybe they're just involved in way too many activities. And so it's like they're just putting more of themselves out there. But in the same sense, they're not able to, just give them time to just kind of chill. So it can create a lot of stress and pressure. Another is taking a look at the home life. Sometimes at home, there can definitely be lots of stressors that can contribute to those mood swings, whether there's lots of fighting and arguing between family members, if there's financial problems or stressors, or any other type of relationship problem. So definitely taking a look at home and identifying any stressors there can be playing a role with mood swings. The next is social life. So a teen will often feel the need to fit in with their friends and be socially accepted. That's pretty much how it works as we get older. And without this type of support and feeling that we're not being socially accepted, mood swings are definitely going to happen. It can definitely take a toll on their self-esteem, which then in turn is going to come out with moodiness. So that lack of healthy support, changes in friendships, and even bullying, both as the perpetrator and victim. So the person that is bullying and the victim of bullying, it can all affect that teen's mood. Social media. This also takes, like this says, takes center stage in the teen's social life. And it can definitely impact whether or not they have a healthy self-image. They have done lots of studies when it comes to like Instagram and TikTok, and they have found that more youth feel more bad about themselves when they are on Instagram and TikTok, because they see other people's videos and their social media and be helpful in some terms. It can also be harmful, which then can take a toll on their mood. So trying to keep up with appearances, engaging in the latest trends, look a certain way, that all leads to social stress and mood swings. I know it was rough when I was a teenager and we did not have social media and cell phones. So I can't even imagine what it's like for teens today. There is just so much more that they're dealing with than I ever did when I was their age. So this is a news article, or not a news article, a news story about TikTok and what is going on with social media when in terms of like mental health, or is it puberty? But there is a growing trend on TikTok where people are sharing their stories of their mental illness, which is great. I'm glad they feel comfortable doing so, but there are some that are encouraging other people to, young people, to take a look at their symptoms, and they're now self-diagnosing themselves with very rare mental illnesses, which is creating a lot more stress than they actually need. And I know this for a fact because I've had a couple of students that I've worked with that have contacted me very upset, saying that they think they have dissociative identity disorder, or they have this or they have that, and they'll show me these TikTok videos and they'll be like, well, see, I have these symptoms. So this is just kind of talking about how TikTok is and trying to encourage young people to self-diagnose when they really should not.
Important story for parents to hear. Rise in teens on TikTok self-diagnosing themselves with rare mental health disorders, in most cases that they don't have, after watching videos on the social platform. It's a story first reported by the Wall Street Journal. Ariel Reshef has more.
DID typically occurs between the ages of 6 and 9.
Experts warning about what they call a troubling trend on TikTok that could leave some teens believing they have a serious mental disorder.
Hello.
Posts with the hashtag dissociative identity disorder and borderline personality disorder viewed hundreds of millions of times. Some of those videos listing possible signs to look out for and encouraging viewers to self-evaluate. 18-year-old Samantha Fridley says she was convinced she was suffering from one of those conditions.
I remember just seeing these videos like on my For You page about just like people saying like, oh, here's signs you may have this disorder. Like it was like bipolar or like borderline or all these different like rare disorders I've never even heard of before. And my mind like would just be like, like maybe I don't have just depression and anxiety, maybe it's something else.
According to the National Alliance on Mental Illness, borderline personality disorder is extremely rare. Only 1.4% of the U.S. adult population is estimated to have this condition, and it is rarely diagnosed in adolescence.
If you spend 15 minutes, 30 minutes, 60 minutes viewing people talk about these disorders over and over and over again, that can make it seem like these conditions are a lot more prevalent than they actually are in the world.
After working with a therapist for a long time, I started realizing, that I don't have borderline, I don't have dissociative identity, I don't have bipolar.
But experts urge parents to maintain an open line of communication with their kids about mental health.
Take the time to empathically hear them out. How intense are these symptoms? How long are they lasting? Does it seem like they're interfering with your child's ability to live the life that they want to live? Again, if the answer to those questions is yes, that's a cue to then take the next steps to get a formal diagnosis.
In a statement to ABC News, TikTok says they care about the well-being of their community and have invested in digital literacy education. The company adding, we strongly encourage individuals to seek medical advice if they are in need of support.
That was Ariel Reshef reporting. We want to bring in now the director of Health Disparities Institute and associate professor of psychiatry at UConn, Dr. Wisdom Powell. Dr. Powell, thanks so much for taking the time this morning on such an important topic.
Thank you for having me, Phil.
When you're sick and have the sniffles and you Google it, you can wind up down a rabbit hole. This is so much more scary than that. These videos are shared and viewed hundreds of millions of times. The obvious question, how can self-diagnosis be a really slippery slope?
This is a really important topic, Phil, because self-diagnosis does increase the danger of both symptom amplification and minimization. What can happen is what we sometimes refer to as a horoscope effect. It's when you read symptoms online and you feel really connected to it, so much so that you believe that you must now have that particular diagnosis. And we know, for example, that it takes a professional really to sort out the difference between a symptom and an actual clinically relevant diagnosis. And the challenge with self-diagnosis also is that you may miss things that are masking physical health problems. We know that there's a high degree of comorbidity between physical symptoms and psychological ones. And sometimes a heart palpitation could mean that you need to see a doctor for your cardiovascular health and not necessarily that you have anxiety or depression or other more serious mental illness.
Yeah, and the parents of a teenager, I'm the parents of two teenagers, you know it's a scary age because they're susceptible to a lot of what they're seeing on social media, and you certainly don't want kids that age diagnosing themselves for anything. As we heard in the piece, the National Alliance on Mental Health Illness says borderline personality disorder is extremely rare. We're talking only 1.4% of the U.S. adult population is estimated to have the condition, and it's rarely diagnosed in adolescence, period. But a lot of these videos have good intentions behind them and aren't meant to elevate conversation, or are meant to elevate a conversation rather, about mental health. So is that what's happening here, or are we seeing more harm than good?
So this is a really important topic also, because we know that this tendency to turn to social media for medical and mental health advice probably also reflects the emergent crisis that we're facing with youth and teen mental health. We know that there have been upticks in mental health issues, including depression and anxiety among teens and youth. And so the fact that they're turning to TikTok and other social media platforms probably suggests that we're not meeting them where they are. We know that in our nation right now that there are not enough psychiatric beds. We actually have a shortage of mental health professionals and therapists. So I can understand why youth would turn to these platforms for support. So I don't think that this is a trend that we're going to see go away. So the important thing for us as parents, as a community of mental health professionals, is to pay attention to these things. Because as you noted, some of the diagnoses that children and youth are coming up with, or that they're attaching themselves to, reflect really serious mental health problems that are very, very rare. And those kinds of diagnoses require physician or clinical intervention to really solidify, and also to assure that parents and teens are getting the right and appropriate mental health treatment for those concerns.
Dr. Wisdom Powell, thank you so much.
Hi, everyone. George.
Important story for
All right. So as you can see, they are using social media more and more, and they're seeing some of these symptoms and self-diagnosing themselves with mental illness. But as we have talked about, that, when the changes of puberty happen, some of those symptoms can be very similar to mental health. So when we look at what is normal teen behavior and what's not. So this is what they consider to be normal teen behavior. So they're wanting to spend more time with their friends and less time with family. They may be reluctant to get up early for school. They need more sleep, or they are developing a larger appetite during those growth spurts. Sadness and anxiety following fights with friends, family members, or if they break up with their partner. There are also some light risk-taking or experimenting with sex, alcohol, drugs, or self-harming behaviors such as cutting, turning to a beloved pet for comfort instead of a parent or friend, and worrying about their physical appearance and trying to fit in. So this is what they have decided, that this is not normal, and this should cause concern if teens are displaying these types of behaviors. So if they're not wanting to spend any time with either family or friends, so they're isolating themselves more, not wanting to hang out with friends or talk to them, and not talking to family at all. If they are absolutely refusing to go to school, and especially if this is happening all of a sudden, and it's they're showing other signs of distress and or depression, there could be something going on at the school, whether they're being bullied or if there's a teacher giving them a hard time. So that, typically is not normal. If they have sudden changes in their energy levels. So if they're sleeping abnormally long hours, or they're not being able to sleep at all, if there's sudden changes in their appetite, so there's consistent overeating or undereating, and also showing that they're having fluctuations in their weight. Sadness and anxiety that doesn't correct itself or decrease in intensity after a few days to a couple of weeks. Extremely risky behaviors and or delinquent behavior. So this is disregarding house rules, parents' concerns, or laws, and they're turning to cutting as a form of emotional or a physical release. Deliberately harming family pets, or torturing or killing other animals. And then sudden and significant changes in eating behaviors, over exercising, and other indications of eating disorders, which I will talk about here shortly. So is it puberty or mental health? Sometimes it's still hard to decipher. So these are common mental health disorders that are in youth. There's depression, anxiety, eating disorders, bipolar, obsessive-compulsive disorder, conduct disorder, oppositional defiant disorder, and PTSD. So with depression, these are some of the emotional changes that can happen. So we have feelings of sadness, which includes crying spells for no reason, frustrated or feelings of anger, even over something small. So say they drop something and it just completely sets them off. Feeling hopeless, feeling irritable or annoyed, loss of interest or pleasure in usual activities. So maybe they were involved in extracurricular activities at school, and now all of a sudden they want to quit everything and they no longer want to do any of those things that they once loved to do. There's a loss of interest or conflict with family and friends, low self-esteem, feeling worthless or guilty, fixating on past failures, being sensitive to rejection or failure, trouble thinking, concentrating, and then maybe thoughts of death or suicide. So the behavioral changes with depression, there could be lots of tiredness and fatigue, having no energy, either sleeping too much or not being able to sleep, changes in appetite, use of alcohol or drugs, agitation, slowed thinking, complaints of body aches, headaches, stomach aches, and maybe you've gone to the doctor or the nurse and they can't find any physiological reason that they may be feeling these pains. Social isolation, poor performance in school, less attention to their personal hygiene. So maybe they're wearing the same outfits day after day after day. They aren't showering. They're not brushing their hair. There could be angry outbursts or disruptive or risky behaviors that could get them in trouble. Self-harm, so cutting, burning, piercing, or tattooing, and then also making a plan of suicide or making an attempt. So with general anxiety disorder, general anxiety disorder, there's a couple of disorders that fall under the anxiety disorder category, but general anxiety is really just having this overall sense of anxiety about everything and anything, or maybe nothing at all. So with generalized anxiety disorder, some of the behavioral and cognitive symptoms is they have a lot of nervousness, or they're tense or restless. They may expect the worst out of a situation, even when there's no apparent reason for that concern. An example is, say a student, they think, well, I didn't really study for this test, so I'm probably going to fail it. And if I fail this test, I'm going to fail this class. If I fail this class, I'm going to fail the grade. And then I'm never going to graduate, and I'm never going to be able to get a job, and I'm probably going to end up homeless. So their thinking just goes out of control. They have troubles controlling their worry. They have the urge to avoid things that may trigger their anxiety. We see this a lot with test taking. A lot of students have a lot of test taking anxiety. And so they can study and prepare, but as soon as they have that test right in front of them, it's like their mind goes blank and they have a really hard time just finishing that test. Troubles concentrating, feeling irritable, problems falling or staying asleep, restlessness, changes in appetite, outburst of anger. And then we have our physical symptoms. So they tend to have a lot of muscle tension because their muscles are so tensed for long periods of time that when their muscles actually finally do relax, they're going to be achy as if they had just been working out at the gym. They can have stomach problems, sweating, shortness of breath, headaches, fatigue, heart palpitations. So all of that is no fun. We also have separation anxiety and social anxiety. So separation anxiety is more common in smaller children. Basically, it's just having this fear of being separated from their caregiver. So they may have nightmares about something bad happening to their caregiver. They may refuse to want to go to school, daycare, the babysitters, because they don't want to be separated. They may be reluctant to go to sleep without their caregiver right there with them. And they just have this overall general sense that something bad is going to happen to the caregiver while they're away from them. Now, social anxiety basically is just having that anxiety around large groups of people. So they could be more likely to make excuses to not be able to hang out with friends just because they don't want to go and, be around other people. They tend to avoid eye contact with adults or peers. They can speak very softly. They tend to be isolated, or on the fringe of the group. So they could have this group of friends, but they may be a part of that group, but they don't really engage in conversation or activities with them. They may sit alone often. They can be overly concerned about negative evaluation or humiliation. And this is why they do not like public speaking, reading out loud, or being called on in class, because they're afraid if they make a mistake or mess up that people are going to make fun of them, or they're worried that they're going to look stupid in front of their peers. So that would be social anxiety. So bipolar disorder. Bipolar disorder it can be commonly diagnosed in teens. A lot of times they try to wait and give an official diagnosis when the person is in their early 20s, because by then they have gone through those stages of puberty and they know that some of the symptoms that they're experiencing is not related to those physiological changes that happens with puberty. So with bipolar, people will go through different episodes. One is a manic episode and the other one is a depressive episode. So with the changes of these episodes, for a manic episode, they may show very, very intense happiness, or being really silly for long periods of time. They just feel on top of the world or the life of the party, but they can also have a short temper or get really irritable. They can talk very fast and talk about lots of different things. When I was doing therapy, I had a couple of patients that had bipolar, and first of all, I could definitely tell when they were going through a manic episode, and it was very challenging to try to follow their conversation because they would be talking about one thing and I'm like trying to catch everything they're saying because they're talking so fast. And then before I know it, they've already moved on to something totally, completely different and unrelated. So that can happen during a manic episode. They can have trouble sleeping, but not feel tired. So I have had patients that could stay awake for 3 full days in a row, but still have all the energy in the world, as if they have done nothing but sleep. They can have trouble staying focused and have racing thoughts. They seem overly interested, or they can get involved in pleasurable but risky activities. And part of the manic episode, it can be common for people to engage in things such as alcohol and drug use. They can engage in like shoplifting. They could spend lots of money that they don't have, or they can also get involved with having unprotected sex with multiple people in a short period of time. Now, when they go through the depressive episode, it's the complete opposite as a manic episode. And pretty much these symptoms are just like somebody that is going through depression. So feeling sad often, feeling irritable, having stomach aches, headaches, changes in sleep and eating, feeling hopeless, having little energy, and thoughts of suicide. So one thing about bipolar disorder that I always like to tell people, because again, I would have students contact me in a panic, worried that they have bipolar. And I'm like, okay, what's going on? And they're like, well, 1 minute I was like laughing and having a lot of fun. And then like 20 minutes later, I was really angry and I was very tearful. And so with bipolar, the shifts in those moods and episodes do not happen within minutes or hours. When a person is going through a manic episode, they are going to display these symptoms for days to weeks on end before they may fall into a depressive episode. And so again, during that depressive episode, they'll be in that episode for days to weeks. So when they have these super quick shifts in their moods, that is typically something that is with puberty and definitely not bipolar. Next, we have our eating disorders. We have anorexia nervosa, bulimia nervosa, and binge eating disorder. So Symptoms of anorexia, basically, this is when a person is, they restrict the calories that they take in, or they have restricted eating, and they can be involved in intensive and excessive exercise. So people that are dealing with anorexia tend to have very extreme thinness, and they have this intense fear of gaining weight and have this distorted view of how they look. And so that causes them to restrict what they eat. And then if they do eat anything, they may overly exercise to rid of those calories that they consumed, even though it wasn't a whole lot, and that can lead to them losing weight. Over time, somebody that is engaging in the anorexia behaviors, they can also develop thinning of the bones, muscle wasting, brittle hair and nails, dry and yellowish skin. The yellowish skin comes from a very large amount intake of carrots. And a lot of times people that are dealing with anorexia, they do eat a lot of carrots. And over years of eating all of those carrots, the pigmentation in those carrots can sometimes get into that skin, causing it to have like a yellowish orange hue. They can also develop lanugo. So lanugo is growth of fine hair all over the body. And the reason why this happens is because another part of anorexia is the internal body temperature is typically below normal. So they are always feeling cold. And so their body is trying to make up for what it's missing. And so it will grow this fine hair all over the body in order to try to help warm that body and get that temperature regulated. They can have severe constipation, low blood pressure, slow breathing and pulse. It can lead to heart damage, infertility, brain damage, and multi-organ failure. So with bulimia, bulimia is basically when a person engages in binging and purging. So binging, they will eat a large amount of food in a very, very short period of time. And then afterwards, after that binge episode, then they will purge in order to rid of the food that they just consumed. So purging can be done in different ways. The most common way is by self-induced vomiting, but they can also purge by abusing laxatives and also excessive exercising. So with bulimia, they tend to have an inflamed and sore throat from the vomiting. Their glands in their neck and jaw tend to be swollen. Their tooth enamel will start to become sensitive and decay after a period of time. And this is due to them being exposed to the stomach acid from vomiting. And then after that, you know, a lot of times it can be very common for people that have had bulimia for a very long time to lose their teeth, and eventually they would have to get dentures. They can have gastrointestinal problems such as acid reflux, indigestion. They can also have intestines, irritation and damage from abuse of laxatives. They could be severely dehydrated from purging, and they can also have this electrolyte imbalance. So the electrolyte imbalance can come from the purging and abuse of laxatives. So our electrolytes are levels of sodium, calcium, potassium, and other minerals that our body produces to make sure everything is functioning properly. So when those levels either get too low or get too high, there's going to be an imbalance. And when they have that imbalance, it can lead to stroke or heart attack. With bulimia and anorexia, out of all of the mental illnesses, more people die from anorexia and bulimia than from any other mental health disorder. And typically when somebody passes away from these disorders, it's typically either a stroke, heart attack, or respiratory failure. Binge eating disorder. So this actually just became a diagnosis maybe about 5 years ago. Before that, they did not consider this a disorder, but binge eating disorder is the most common eating disorder out of all of them. So basically, it's just consuming large amounts of food in a specific amount of time or a short period of time. And it's similar to that as bulimia, except they don't purge. They just consume the food. So they may eat very fast during these binge episodes. episodes. They can eat when they're full or when they're not hungry. They'll eat until they are overly full. They tend to eat alone or in secret because they're very embarrassed or ashamed of their eating habits. And when they feel ashamed or guilty about their eating habits, then as a way to cope, then they engage in another binge episode. So you can see how that cycle just continues. They can often diet frequently, but they typically do not lose weight. The next is obsessive compulsive disorder. So people with OCD have these obsessive thoughts, and in order to make those obsessive thoughts go away, they engage in the compulsion. There's different types of obsessive thoughts and compulsions. Some people may have motor tics that are repetitive, such as eye blinking, facial grimacing, shoulder shrugging, or head or shoulder jerking. And vocal tics can also be common, such as clearing their throat or making grunting sounds. But some of the obsessive thoughts that somebody may have is this constant irrational worry about germs and contamination. I will tell you that when COVID first started happening, I always thought of people that was suffering from obsessive compulsive disorder. I'm sure that was a very, very difficult time for them when COVID was first coming, and we didn't know much about it. And I'm sure they're probably still dealing with it now. Even though things have gotten better, it's still out there. So in order to rid of that obsessive thought, their compulsion may be to excessively clean the house, the car, or washing their hands or washing a part of their body. And they will wash it so much that their skin can become raw. It can be very dry and crack. So it can be painful. There could be another type of obsession as having excessive concern with ordering and arranging things. So they like things to look and be in certain places. So they may spend lots of time going and rearranging things to make it so it looks the way that they want it to look. They can have fears of losing something valuable. And so even though there really isn't value to some of these things, they just have a fear of losing that. And so that's when people start hoarding things. So if you've ever watched the show Hoarders, so hoarding is actually a part of obsessive compulsive disorder. And basically it's because they have these obsessive thoughts of not wanting to get rid of stuff because they have some unreasonable attachment to these things. And so in order to make those thoughts better, then they hoard everything to keep it there. So some other behaviors that they can do is they may repeat phrases or tunes or names. They may count things. Everything has to be counted by a certain number, or they may constantly seek things for reassurance. I've seen this where, somebody would leave work and they were worried that they left the stove on. And so it would bother them to the point where they would have to leave work numerous times to go home to check and make sure that it was actually turned off. Or before they go to bed, they have to lock the door 3 times before they know that everything is good. Next is oppositional defiant disorder. So they call this ODD. And this can begin during the preschool years, but sometimes it can develop later, but it almost always starts before early teen. And so these behaviors can cause impairment with family life, social activities, school, and work. So with these behaviors, they may have by other people and often angry and resentful. They can also be very vindictive or spiteful. So it's like if somebody's done something to them or made them mad, then they think about how they can get back at them. And then they can have argumentative and defiant behaviors. So they typically will argue with adults all the time or people in authority. So if you're getting phone calls all the time from school saying that, that your youth was yelling and screaming and arguing with the teacher or the principal, if there's police involved, they will argue with the police officers. And they actively and typically will refuse to comply with any request or rules. They can deliberately annoy or upset people or blame others for their own mistakes or their misbehaviors. And then we also have conduct disorder. So conduct disorder is a little similar to oppositional defiant disorder, but it's on its whole nother level. Symptoms of conduct disorder are a lot more intense and more severe. So basically with conduct disorder, it can be very, very hard to control kids that have this disorder. And typically they will never follow these rules. They can act very impulsively and not think about other people's feelings. And there's different behaviors that they can engage in. And for boys, they are more likely to display the aggressive and destructive behaviors, whereas girls are more likely to show deceitful behaviors and the violation of roles. So with the aggressive conduct, they can be very intimidating and bully other people. They can physically harm people or animals on purpose. They may force someone to perform an activity that that person's not comfortable with, such as sex. They can use weapons. They can engage in arson and start fires or other intentional destruction of property. They can lie often, breaking and entering, stealing, forgery, skipping school, running away from home, alcohol and drug use, and sexual behavior at a very young age. So we see conduct disorder a lot in kids that are a part of the juvenile detention system, that have gotten in trouble and now are there. And also too, so some of our more infamous serial killers like Jeffrey Dahmer and Ted Bundy and all of those, a lot of them looking back at their childhood, they determined that they had conduct disorder as children. And so typically what can happen with conduct disorder, if it goes untreated in children, as they get older, it can develop into antisocial personality disorder, which people would refer to that as, a person being a sociopath. So that's why it's so important, not just with conduct disorder, but with any mental health issues, that they get help early. We also have PTSD. So this is basically, PTSD is something that can develop after anything traumatic that's happened, which can include abuse, physical and sexual assault, accidents, natural disasters, terrorist attacks, war, or unexpected death of a loved one. And that is not a full list. So everybody, they identify what is traumatic to them. It's individual for everybody. So, something a person may go through could be traumatic to them, but for somebody else, it's not. All right, so our next part is how to communicate during a mood swing. Sometimes that can be very challenging. When there's a mood swing going on, sometimes we just want to throw our hands up in the air and lock ourselves in our room and just say, okay, by the time I leave, my child is going to be better and it's all good. But that doesn't typically happen. So ways that you can communicate. First, you want to recognize what's going on. Be careful not to jump too quickly into discipline mode, because if you immediately start yelling at your child or making threats of grounding them or taking away things, then all it's going to do is escalate that situation and they could get more angry and aggravated. Your child isn't always just misbehaving or acting out. This can be very normal for teenagers. And it's definitely not easy to deal with bad or sad feelings when you can't figure out what's going on. So this is new for them because they haven't really experienced all of these changes that they're going through with puberty. And sometimes it can be really hard for them to recognize, these changes or even know that something's taking place. So really one of the best things you can do is talk about it. Encourage your teen to identify these new feelings that they are experiencing and help them recognize the signs of their bad mood so that they know that when this is going on, it's more likely because of these changes they're going through, not because they have a bad life. Point out that if they don't know why they're sad or angry, that it's okay. There's times where I'm angry or upset and I don't really have a actual reason to be or feel that way. It is okay to have moments where we're just not feeling it, and it's totally fine. And let them know that they're not alone, that everybody goes through all of these changes. Try to teach coping skills. So online, you can find lots of different resources on coping skills. We all need to learn how to cope with our emotions and learn what triggers us in our feelings of anger, sadness, and what we can do to try to control it so we can function. Typically, teens don't know how to do that yet, or if they do know coping skills, a lot of times they're not always the healthiest. They may vape, they may drink alcohol, they may shoplift, so they don't really know what these healthy coping skills look like. So when the situation is calm, you can role play through a few scenarios. You can teach them how to count back from 10. You can teach them box breathing, encourage them to go for a walk, listen to music, just something to kind of help calm them down. And if you notice that you're in a bad mood, try to model some of these coping skills. So not only is it good for your own physical and mental health, but it also sets an example for that teen. Try to support a healthy lifestyle as best as you can. I know I definitely would not be good at this, and I know it's really, really difficult, but try to be a good role model and choose those appropriate behaviors by trying to eat more healthy, making sure you're staying hydrated, and making sure that everybody is getting enough rest. The next is you can try to find healthy distractions. So you can encourage your teen to take these preventative steps through creativity, through activities, arts, crafts, different things like that. Distractions are really good to help take a teen's mind off of their sadness or stress. And hobbies can even help their mood even it out. Working on a hobby can teach them coping skills, resilience, and they can channel that negative energy and turn it into something positive. And anything can become a hobby, and it's something that they may enjoy for the rest of their lives. So you just have to encourage it and give them different ideas and thoughts. And also, it's important to give them space. As much as we want to be there to try to help them and protect them, sometimes it can be a little overwhelming for them. So it is okay and appropriate to give them space at times. As an adult, sometimes we need our own space too. So just because they're younger doesn't mean that they never need space. If they need a good cry or they need to pace around the room, try to give them the privacy to do that, because for some people, it can be very embarrassing for them if they are crying in front of other people. And we definitely don't want them to hold back, doing those things if that's going to make them feel better. And offer them comfort and let them know that you're there to talk with them if they need to. So ways that you can keep that line of communication open. You definitely don't want to ignore or pretend that it doesn't exist. When it comes to mood swings or mental health, that's the worst thing that you can do. Be genuine. So make sure that they know that what you are saying to them, that you genuinely mean it, because they can see through when adults are faking it. And if, they see that you're faking it, they may be more likely to shut down. And if you are uncomfortable talking about something with them, it is okay to say that. Our teens do not expect us to know everything. So you can kind of use it as a way to help them understand that, if this is difficult for me, I know that this is difficult for you. So you can kind of empathize with maybe what they're going through. Allow for silence, just like anybody. Sometimes it can be really hard to express what we want to say. And just because there is silence, it doesn't mean that they're ignoring you or that they just refuse to talk. Sometimes they're silent because they're trying to think of what they want to say or think about how to express what they're feeling. So don't interrupt if there's a silence moment. Just let them talk it or think it through, and just be patient with them. And also show acceptance. So mental health challenges we know can occur at any age. And sometimes adults can be like, well, you're a kid. What could you possibly be upset about or depressed about? You have no responsibilities. You don't have to pay bills and all this other stuff. But if we are talking to them about that, it's going to invalidate what they're feeling. And so if they feel invalidated, then they're more likely to shut down and not continue that conversation. You want to be supportive, but don't enable them. If your teen is opening up about their struggles, be patient, but really listen to them. Let them know that you love and care for them and you want to help as much as possible. If, you know, if they're like involved with like some friend groups or anything like that, that's creating some of these struggles, don't jump to conclusions and start pointing the fingers at friends or situations, because that's not going to make the situation better. And don't enable them by offering to do things for them when they are not mentally and emotionally feeling well. If they're going through the changes of puberty or they're having some mental health struggles, they still have to know that they still have to have responsibilities, even if they're not emotionally feeling well all the time. Don't use dismissive or judgmental language. Telling somebody to stop feeling sad is not helpful. Or if they're dealing with an eating disorder, telling them to just start eating, that's definitely not going to make anything better. So saying things like, you'll get over it, it could be worse, everything's going to be okay, how do you think I feel? It's only going to make that conversation worse. So instead, ask questions of, how can I best support you right now? What can I do that will help you feel a little bit better? And reassure them that they're not alone, that when it comes to all these changes, that we all go through it. You can maybe share the changes that you went through and the experiences you had. And also reassure them that you're going to be by their side through it all. Get your youth and mental health treatment. So if there are concerns that it could be something more than just puberty, make sure you make an appointment to get them in to see a psychologist or a counselor. Talk therapy can provide a lot of great benefits in treating mental health. You may start off the conversation as, it worries me to hear you talk like this. Maybe let's talk to somebody about it and see what they say. You can always contact the primary care doctor to get recommendations. Sometimes primary care doctors can also start them on a medication for like depression or anxiety, if that is a route you are comfortable taking, or they may refer you to a psychiatrist. If you're an educator or somebody who's not the primary caregiver for that youth, it's going to be important that you follow up with their caregivers so that they can get their child help. Now, if the caregiver or family refuses to get them help, try to look at other options such as in-school counseling. A lot of schools are contracted with some behavioral health agencies where they will come to the school and do counseling. And also, depending on how old the youth is and what state they live in, some agencies do offer counseling to youth without parental consent. But in West Virginia, if they are under the age of 18, it does require consent from a parent or guardian. So these are some warning signs that a youth might be suicidal, because sometimes with puberty and mental health, suicide can, definitely be a part of it. So if they're talking or writing about suicide, so if they make statements that, well, the family would just be better off if I wasn't here anymore, or I just want to kill myself, that is something to be concerned about. If they're withdrawing from all social contact, so that includes their friends, if they're having very intense mood swings, if there's an increased use of alcohol or drugs, if they feel trapped or hopeless about a situation, if they have changes in their routines, including eating and sleeping, if they're engaging in risky or self-destructive behaviors or activities, if they're giving away personal belongings and they have no explanation as to why they are doing this, and if there's personality changes of them being very severely anxious and agitated, and with also experiencing some of the symptoms above. So if you have concerns that a youth is suicidal, it is okay to ask them if they have in the past, recently, or currently thought of, or if they've had plan or intent to complete suicide. There's this taboo that people feel asking a person about suicide is going to put that idea in their head, but it is not. Asking them is not going to make them suicidal or more suicidal. And one thing I learned in a suicide training that I attended is that we do not have the power to put that kind of feeling and thought into somebody's head. So if there is concerns with your youth's behavior and you ask them, if they are suicidal, by the time you ask them that, if if they have been feeling suicidal, they've been feeling that way before you've asked them that question. So, you also want to ask them if they have anything in their life that they feel is worth living for. So we call this protective factors, and it's so important that anyone that's feeling suicidal has protective factors. So this is what helps them keep going. These are the things that stop them from acting out on these suicidal thoughts. So this can be family, friends, pets, a partner, job, values and morals, anything like that. And if you think that your youth is in immediate danger or they seem very suicidal, please call 911, or you can contact the National Suicide Hotline at 1-800-273-TALK. And from there, you can talk to somebody and get help. So after gaining a better understanding of how the youth is feeling, it's so important to offer your emotional support. Please don't tell them that they're being dramatic or that, they really wouldn't do anything like that. Make sure you're validating them by paraphrasing what they say. So, they tell you how they're feeling and you may say, it sounds like you've given up, or you feel that there's no escape out of that situation, and let them know that you deeply care for them and that you're concerned. But try to also put it in there that suicide is not a solution, and let them know that there are so many options available and that you would like for them to give that a try. And again, make sure you reassure them that you are there with them. Sometimes this can be a very lonely time for anyone that's feeling suicidal. So knowing that they have a person there that's going to help and support them can really help with that recovery process. So ways that you can prevent youth suicide. Again, make sure we are addressing that depression, anxiety, or any mental health concerns. Even if it's some of those changes with puberty, because some of it can look like depression. So it's okay to talk about that and try to understand is my child going through puberty, or is there something more going on? So don't wait for them to come around and ask and talk to you first. There's a good chance they're not going to do that. So if you have concerns, it's okay to say, hey, is everything okay? I'm concerned about you. Pay attention. If the youth is thinking about suicide, they're most likely displaying warning signs. Typically with youth suicide, so youth suicide is the second leading cause of death for people ages 10 to 24. And typically when a youth makes a suicide attempt, 4 out of 5 of them will show warning signs. So listen to what they're saying, watch how they're acting, and never shrug off threats of suicide as them just being a drama king or queen or teen angst. Try to discourage isolation during this time. So encourage them to spend time with supportive friends and family. Support the treatment plan. So if they're already undergoing treatments, remind them that it's going to take time before they feel better. Help them follow up with the doctor's recommendations and encourage them to participate in activities that can help rebuild that confidence and maybe make them feel better. If you have medications, alcohol, firearms, please make sure that you have those put away and locked up. Because if access to means can definitely play a huge role if a teen is already suicidal. So how do we address, again, know the warning signs? So these are all the things that I have been talking about, having the loss of interest, low energy, changes in sleep and eating, fear of weight gain, too much exercise, self-harm, risky behaviors, thoughts of suicide, and educate yourself. So there's lots of great education available online to educate yourself on mental illness. So I do recommend these. Please don't get your education on mental illness from TikTok because we know that that's not always the best information. But NAMI, the National Alliance on Mental Illness, they offer free 6-session education program for anybody that's caring for a youth experiencing mental illness. The National Institute of Mental Health, they have awesome information and resources. And then there's also mental health first aid, and they have a youth course. Sometimes this costs money, but I actually took it about a year ago through Eventbrite. They offered it for free, but it's an 8-hour in person, and sometimes they'll do it virtually, but it's a course that teaches you how to help somebody that may be experiencing a mental health crisis. mentalhealth.gov, Center for Disease Control, and SAMHSA. Again, they all have excellent resources. They have free handouts that you can order, brochures, books, different things like that, they all mention on youth mental health. We also have a lot of crisis resources. Our crisis text line, you can text home to 741-741. They offer free 24/7 support by trained crisis volunteers. The National Suicide Prevention Lifeline, the Trevor Product, they provide suicide prevention and crisis intervention to people of the LGBTQ+. But all of them offer 24 hours a day, 7 days a week crisis support, whether it's on the phone, on their website, or through a text line. Our West Virginia Child Abuse Hotline, again, they have somebody there that you can make a report. The National Human Trafficking Hotline and the National Sexual Assault Hotline. So what you can do for yourself, being a parent is exhausting enough. Dealing with a teen that's going through puberty just makes the struggle so much difficult. So when you're dealing or working with youth that may be struggling with mental illness, suicide, or just the intense changes of puberty, it's very, very exhausting and it can be worrisome. So it's so important that you as the adult are taking care of your own mental health as well. We should be practicing what we preach. And I truthfully should be practicing what I preach. As I just said that now, I was like, Autumn, you should probably take your own advice. But counseling is not just for kids or teens. Millions of adults engage in counseling every single day. And they always say, you can't help others until you help yourself first. It's really difficult to be there for other people, especially our teens, when we're going through it ourselves. So learn different mindfulness and relaxation exercises. These are free and they're online. You can go on YouTube. If you just search deep breathing meditation, guided imagery, or progressive muscle relaxation, they have thousands and thousands of videos that can help teach you this, just to kind of help calm the mind and get you refocused so we can, it can help you to address whatever situation is going on with your teen. There's lots of in-person and online support groups where you can talk to other adults who may be dealing with similar situations. And don't try to hide this from friends and family. Be open and honest with them and say, you know what? I'm really struggling with this. I don't know if it's puberty. I don't know if it's mental health, but I'm losing it. And so surround yourself with supportive and positive people, and, talk to other family members or friends that may have gone through the changes of puberty with their own children, and, maybe get some other thoughts and ideas on how you yourself can survive it. So these are the resources that I used for this presentation. And so if you have any questions, you are always more than welcome to email me. My email is awagner@missionwv.org. If you have any questions, concerns, anything like that, if you are wanting some referrals for counseling, psychiatry, anything like that, that is available in West Virginia, I am always happy to get that information for you. And if you ask a question and I don't have that answer because I don't know everything, I will do all the research to get that answer for you. So thank you so much for listening.
Autumn, before you kick off, we do have a question in the chat box. It's been there for a little while. So any suggestions for a child with autism going through the change? He hits himself, causing bruises.
So with autism, it's definitely challenging because we have a different aspect that is into it than somebody who isn't on the spectrum. And so typically when a child with autism is self-injuring, a lot of times it's because they do not know how to express their emotions. They have a very hard time trying to, tell somebody what they want or what they need. And so, like, for example, if it's, like somebody that maybe they need the remote control for something and they don't know how to express that. And so, their means of getting what they want is by self-harming or injuring themselves. And so, what we do as a parent, we'll give them what they want because we want them to stop doing that. But then in their minds, they say, oh, well, if I hurt myself, then that's how I know to get what I need or want. So it's going to be about working with them to identify and help them to learn how to express what they want and need. So instead of hitting themselves, maybe they make a certain hand gesture, or they make a certain noise, or they do something that isn't harming themselves. So they know, the parent knows, okay, they said that, or they displayed this hand motion, so I know this is what they want. It'd also be helpful to work with the doctors on, with all of those changes, because sometimes it's already difficult for them to understand what they're thinking and feeling and how to process those emotions. But when we add puberty on top of that, it just brings on a whole new ball game. But it is going to be important to, try to understand that if they're self-harming in order to get what they want or their needs met, then it's about retraining them to figure out more healthier ways of getting what they want and need.
Thank you very much. If there's any more questions, you can put them in the chat box, or you have Autumn's information. We have lots of professionals on the line, but I also saw some parents and grandparents. So we're very thankful for that you joined
Yes.
us. We all remember puberty, and man, it was tough. So thank you all for joining us.
Yes,
There were
thank
lots
you.
of questions about our CEUs, if the webinar was going to be recorded. The webinar was recorded. It will be posted on our YouTube channel probably tomorrow. If not, let's see, today's Thursday. If not, especially, it'll be there by Monday at the latest. Your CEUs, after you fill out the survey link at the bottom, it'll ask you if you need CEUs and what type. So that is your way of letting us know you need it. If not, we will send certificates. Those may go out as soon as tomorrow. If not, it'll be on Monday. So we always thank you for your time. We know everyone is busy, and to join us, and especially to join with Autumn, who is just a wealth of information, and we love
Thank
working with her.
you.
So we appreciate
I love
you.
working with all of you. So.
All right, you guys have a great day. The survey link. Say that again.
Oh, no, I didn't say anything. Sorry if I did.
That's okay. The survey link will be, it's in the chat box. We have the QR code, but it will also be emailed to you if you registered. So, and if that doesn't work, then you please contact us. You can contact rwhite@missionwv.org or anybody here, and we will get you that information. Great job. And for one, am glad I'm not going through puberty anymore.
Me too. You can't pay me enough to go back to those days. I'm sorry. But I will say just one last thing. This weekend is supposed to be in the 80s and beautiful and sunny. So you, as the professional, the parent, the caregiver, the guardian, please make sure you're taking the time to go out there and enjoy some of that sunshine. Self-care is not selfish. It's actually a priority. And I think a lot of us, we put our own priorities on the back burner because we're so busy taking care of everybody else. But, you all do matter, and you are important. And without you, the youth, they don't stand a chance. So we appreciate everything you're doing as a professional and a parent and caregiver. So thank you.